Muscle strengthening exercises are important. Many forms of exercise increase muscle strength. All involve progressively increased resistance. When a muscle is very weak, gravity alone is sufficient. As muscle strength increases, resistance is gradually increased, either with stretchy bands or weight training. In this way, muscle mass and strength are increased and endurance improves. These task-oriented exercises are for people who have problems with coordination and balance, usually as a result of a stroke or brain injury. The exercises involve repeating a meaningful movement that works more than one joint and muscle, such as picking up an object or touching a body part. The purpose of these exercises is to improve a person's ability to walk independently or to walk with assistance. Before starting ambulation exercises, some people need to improve a joint's range of motion or muscle strength. Some people need an orthotic device, such as a brace. Training may begin on parallel bars, especially if the person's balance is impaired, and progress to walking with mechanical aids such as a walker, crutches, or a cane. Some people must wear an assistive belt, which the therapist uses to prevent the person from falling. As soon as a person can walk safely on a level surface, training to step over curbs or to climb stairs may be initiated. A person being taught to climb upstairs is instructed to step up with the uninjured leg first. To climb downstairs, the person is instructed to step down with the injured leg first. These instructions can be memorized with the phrase, "Good is up, bad is down." A combination of range of motion, muscle strengthening, and ambulation exercises is used to counter the effects of prolonged bed rest or immobilization. General conditioning exercises help restore proper blood flow and increase heart and lung function. Transfer training is often a critical goal of rehabilitation because people who cannot transfer safely and independently from bed to chair, chair to toilet, or chair to a standing position generally require 24-hour assistance. The techniques used in transfer training depend on whether the person can bear weight on one or both legs, has sound balance, or is paralyzed on one side of the body. Assistive devices can sometimes help. For example, people who have difficulty standing from a seated position may benefit from a self-lifting chair, a chair with a raised seat, or another assistive device. For people who have low blood pressure and who get dizzy when they stand up, orthostatic hypotension, a tilt table may help. The person lies face up on a padded table with a footboard and is held in place with a safety belt. The table is tilted so that the angle is very slowly increased until the person is nearly upright. By slowly increasing the angle, the person's blood vessels regain the ability to constrict. How long the position is maintained depends on the person's tolerance, but it should not exceed 45 minutes. The tilt table procedure is performed once or twice a day. Its effectiveness varies depending on the person's disability. Occupational therapy is intended to enhance a person's ability to perform basic self-care activities, useful work, and leisure activities. Even simple tasks require the coordination of many abilities.
That's good. This one.